Hi, I'm Kathleen Kelley, one of the pediatric nurse practitioners here at Coastal Pediatrics, and I'm going to talk to you today about constipation. Constipation, the definition of it, relies mostly on the consistency and the firmness of the stool, not solely on the frequency. A child can have a normal soft bowel movement once every 3 days, and this can be their normal bowel pattern. Constipation is most likely functional for most children, meaning that there is no disease process occurring in their body. Constipation also occurs during certain times of a child's life. For instance, in infancy, when switching from breast milk to formula, when switching formulas, when adding solid foods, or even switching to whole milk. We also see it in early childhood when toilet training or at the addition of preschool. For older children, it's usually a change in their diet, their routine, or any family stressors, a change in family environment, surgery, or even summer vacations. Now, most parents can recognize the event that caused the constipation and resolve it on their own. However, sometimes we are needed in that help. Nutrition is our first attempt and a key part of constipation. We offer suggestions like increasing the fluid and fiber in the child's diet and watching their intake. And if you identify a food source that has been causing the constipation, removing or limiting that from their diet. Sometimes medications are needed, and we like to use non-stimulant laxatives, such as Glycolax or Miralax. This simply helps to retain more water in the stool to help it become more comfortable for the child to pass. Sometimes children become so backed up or full of stool, we require to clean them out. We use a series of medications, such as Senecot, which helps to stimulate the bowel and push the stool down to the lower part of the bowel, and enemas, which helps to unplug or remove the harder stool from the lower bowel. These two medications in combination help to remove the stool comfortably for the children. Another issue we usually see with children is stool retention. So the young child who is trying to toilet train, they sometimes get afraid to pass the bowel movement because they have one firm or large or painful bowel movement. So the next time that they have the urge to pass the bowel, they hold it. Some parents recognize this as a child posturing, squatting, hiding in the corner, and they sometimes also mistake this for the child trying to actually push the bowel movement out when they are actually holding it in. When we see these kind of gestures or movements as recognized by the parents, we definitely will take action. Again, first offering nutrition and then offering medications to help the child get through to a normal bowel pattern. We also, at that age, recognize the fact that they work really well in a positive reward system and offering them praise every time they have a bowel movement. Now, sometimes older children can have been holding their bowel movements for so long they've actually lost control of their bowels. This is obviously an embarrassing problem, as you can imagine. And these children are so full of stool that they start to have leakage coming out of their bottom into their underwear. It could be anywhere from small amounts to large amounts. So again, we use a clean out or the use of Senecot with enemas to help their bowel movement reestablish. So as you can understand, constipation is a problem for most children and family in their daily life. Here at Coastal Pediatrics, we like to help parents identify the cause and give the best treatment for them. We also are very fortunate to be involved in some pediatric research for constipation. We offer our patients the opportunity to participate in this research and to help find better medication management for constipation. So please come and see us at Coastal Pediatric Associates if you have any concern over your child's bowel habits or would like to participate in our research. Thank you very much.